Hi, my name is Jeff Oakson, and I direct the Orofacial Pain Program at the University of Kentucky. We have a graduate training residency program where we talk with our residents about TM disorders and orofacial pain. And each year, we have an annual, or what we call mini residency program, where we invite people from all around the world to come and join us for a week of didactic information regarding TM disorders, orofacial pain, and many of the related subjects. We have 8 different faculty who participate in presenting this information to us. Last year we had 55 individuals, came from 21 different countries. So it's a wonderful international experience with your colleagues from both national, international, and at time. We talk about all the important things that dentists need to appreciate when it comes to doing dentistry. So therefore the subjects will be for general dentists, they'll be for prosthodontists, for orthodontists, for endodontists, for oral surgeons. Because we talk about things like orthopedic stability in the masticatory system. And when is occlusion important for TM disorders, and when is it not important for TM disorders? So we'll talk about all those different factors like that, and the kinds of patients that you see on a regular basis. We'll talk about taking a good history and an examination for the TM disorder patient. We'll talk about where psychology is important. And as pain becomes chronic, psychology can be very important in promoting some of the pain, or enhancing some of the pain. We'll bring in an oral medicine specialist to talk about oral lesions. We'll bring in a radiologist to talk about oral radiology. And then we'll divide our TM disorders into muscle pain and intracapsular pain, and talk about the muscle pain issues and how you manage those patients. We'll talk about intracapsular issues. We'll talk about normal anatomy and then clicking, popping, locking, and how you manage those patients with intracapsular types of problems. When are appliances indicated? And what would you expect with an appliance? What appliance would you use for which patients? And when an appliance reduces the patient's symptoms, what do you do next? It's a good question, because we used to believe that as soon as the appliance made a difference in the patient's pain, then we had to change their occlusion. Well, we'll talk about 8 different things that appliances do for patients that could explain the reduction of painful symptoms. Only one's got to do with occlusion. So we need to understand those concepts. We have a physical therapist. We're going to talk to us about that. And then we're also going to get into dental sleep medicine. We have a pulmonologist who will talk to us about sleep, normal sleep. We have dental or orofacial pain faculty who specialize in dental sleep medicine, and they'll talk about appliances and how they make appliances. And we're also going to have to move into this field of pain and talk about neuropathic pain and some of the problems that we face as in trigeminal neuralgia, but also continuous neuropathic pain, some of which are felt in teeth. And so we'll have a discussion on 8 different reasons why teeth hurt that are not coming from the pulps or the periodontal structures. And dentists need to understand that before we start doing a lot of endodontic procedures and extraction of teeth. So we have this whole week on campus at the University of Kentucky. We welcome you to come to our campus. The tuition includes breakfast every morning and lunch in the afternoon, and then 2 of the dinners. And the first dinner is a welcome get-together, so everybody meets everybody. And the last one on Thursday, we take people on a couple buses, and we go out to our famous horse farm or horse track, and we look at the auction, and we go to a mansion and have sort of a graduation party where we give you certificates for this week. So it's a 40 hours long didactic information. We welcome you to come attend, and we'd love to have you in Lexington. And if you're interested to know more, you can look at this webpage and list all the different subjects we'll be talking about, and actually can register for the program. So I look forward to seeing you in Lexington.